Well, as we look towards a possible coronavirus vaccine with some optimism, or maybe hope's a better word, and we deal with surges of COVID-19 in areas such as Nelson Mandela Bay, there are now big concerns around tuberculosis. TB has been a disease that we've been found impossible to conquer in South Africa over the last 150 years. Dr. Francesca Conradie is the principal investigator at the Clinical HIV Research Unit at Wits University, looking at tuberculosis in this instance. Dr. Conradie, good afternoon to you. You're calling for what you call missing cases of TB to be found. I presume you mean people who would normally have been diagnosed with tuberculosis in 2020, but because of everything that's happened, those cases have been missed.
That's correct. So the way we diagnose TB is on a really sophisticated test called the Gene Expert. We get somebody to cough in the bottle, and then we find TB and also find whether it's resistant or sensitive to our most common drugs. But obviously, in order to find those cases, we need to actually see them. There was a dramatic drop in the number of Gene Experts we did between March, April, and May. It started to pick up, but there is no reason to suspect that the real incidence of TB has dropped. So there are people who are walking around in the community who are infected with TB and are not getting treatment. So what does that mean? If you've got TB, it's bad for your health. It's a progressive lung disease that causes harm to your pulmonary function. But more than that, TB is a transmissible disease, very similar to COVID in that infected individuals will transmit it to uninfected individuals. So if we're missing a bunch of cases, those individuals are walking around in the community continuing to transmit TB. So not only have we missed those, we're missing the future ones.
Is it possible to know how many cases we might have missed? And I suppose you would start with the figures of roughly how many new cases of tuberculosis are diagnosed each year.
So we diagnose about 300,000 cases of TB, which puts us about 5th or 6th in the world in terms of TB incidence. At the moment, we've found quite a few less. We've still got time to catch up, but that's why I've embarked on this call to action, to remind both healthcare workers and individuals in the community that if they have a long-standing cough, if they're HIV non-infected, a cough of more than 2 weeks, if they're sweating at night, if they're losing weight or they have a fever, they possibly have TB and they need to be screened. If you go to the local clinic, we have a really robust testing scheme that will find if you have TB, and it's a treatable condition in the main. So it's really to remind people that TB is still around.
Where do we normally diagnose these cases? You mentioned clinics. I mean, do people present? Does someone feel unwell and then go to a clinic? Perhaps some minors might be screened while at work. I mean, where do we find the majority of the cases? Is it the clinics you refer to?
So the local clinics, so the local community healthcare clinics, what's supposed to happen is that every single individual that comes through our clinics, but particularly the HIV infected individuals, we ask those 4 simple questions that are asked for, and then if they test positive for those, we then proceed to do a laboratory test. So most of our diagnoses are made at the local clinics, at the clinics, the GPs. When people get really sick, obviously they end up going to hospital with TB, but we prefer to find ambulatory patients who are not that ill. And most of our diagnoses are made there.
So, I mean, this is the problem, is that if you don't get treatment, you get worse and worse. And the reason I say that is that in the end, there'll probably be a way to work out how many people actually contracted TB in 2020, even if you don't get to diagnose all the cases. You'll be able to see how many more serious cases you got in 2021, 2022.
Yes. So anecdotally, speaking to my friends who work in clinics and in hospitals, they're saying they're seeing far more advanced cases of TB than they used to see, say, 6 months ago. Of course, that's anecdotal, but it is a sign that people are getting sicker before they present to clinics. The ideal TB diagnosis is made with someone who's been coughing for 2 or 3 weeks. We make the diagnosis and test them and treat them immediately. And therefore, they don't have much lung disease. And more than that, they don't spread it to anybody else.